Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. A bill for an act to establish Nigeria Center for Vaccine Research and Development scales second reading in the House of Representatives. The Nigeria Center for Disease Control, in collaboration with World Health Organization, the media, other partners, organized workshop to review infodemic management response to COVID-19 and other infectious diseases. The World Health Organization urges wider vaccination coverage to contain Omicron-dominated COVID-19 spread. And at least 60% of the persons who took the first dose have taken the second dose in Delta and Lagos states and also the Federal Capital Territory. According to the report by the National Primary Healthcare Development Agency, the top 5 performing states on the COVID-19 mass vaccination campaign in Nigeria remains Nasarawa in first place, followed by Jigawa, Ogun, the FCT, and Kwara, respectively. The highlight also shows that Nasarawa and Jigawa continue to outperform other states, with Nasarawa performing its second dose performance by 2%, and this is compared to last week. Now, according to the agency, it is a race to ensure that 50% of the nation's eligible population in all states will be vaccinated by the 31st of March 2022. Let's now take a look at the latest infection figures.
53 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states. That's an increase from figures reported earlier. Gombe accounted for the highest number of cases with 16 infections, Rivers had 12, Cross River 8, while Kaduna and Niger states registered 4 cases. The total confirmed cases in Nigeria now stand at 253,780. The report also includes 0 cases from Ekiti, Ondo, Ogun, Plateau, and Sokoto states. 99 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,144. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,139. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases and admission, with over 17,000 positive samples, followed by Ondo and Benue State. Over 15.9 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 6.3 million of the population have been fully vaccinated. In Africa, over 10.9 million persons have tested positive, while over 241,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 397 million, while deaths are now beyond 5.7 million.
And a bill for an act to establish the Nigeria Center for Vaccine Research and Development has scaled second reading in the House of Representatives. The bill, which was sponsored by Representative Kasimu Maigari, seeks to ensure local production of vaccines. The lawmaker hopes that the move will also boost capacity for manufacturing essential medicines, including COVID-19 vaccines, to ensure medicine security.
It will help the whole nation to develop our own vaccine and to save a lot of billions we are expending annually. Mr. Speaker, I can remember very well former President of America, Bill Gates, established the same type of research center in America, which is developing hundreds of millions of vaccines daily. And in Africa, the whole Africa, we don't have any vaccine development center. So it's very important if we can have this bill passed into law. It will help our researchers and also help our nation
Well, in the midst of the scourge of infodemics around the world surrounding the coronavirus pandemic, as well as COVID-19 vaccinations in Nigeria, stakeholders have met to develop an integrated plan for infodemic management in the country. The two-day meeting, organized by the Nigeria Center for Disease Control in collaboration with Breakthrough Action Nigeria, reviewed the existing management plan. According to the organizers, the strategy is to help stakeholders prepare for the future, and not just concerning COVID-19 infodemics, but for other outbreaks of public health concerns. Other partners at the meeting included representatives from the National Primary Healthcare Development Agency, the NOA, the Federal Ministry of Health, the WHO, media personnel, and some non-governmental organizations.
Workshop is as a result of the importance of infodemics in this pandemic. We know that infodemics has been a huge challenge from the beginning of the pandemic since 2020, and then we've been managing misinformation, working with relevant stakeholders. This time around, we are bringing stakeholders together to review the existing infodemic management strategy for the country, to reflect the current realities, and to see how we can expand this to begin to address other infectious diseases and other issues. That's why we're working with Primary Healthcare Development Agency to ensure that the issue of vaccination, not just for COVID-19, but other vaccine-preventable diseases are taken care of. So we're working with stakeholders like media, partners, MDAs, to ensure that we all work with one front and we have consistent messaging.
And the president of the World Hepatitis Alliance, Mr. Danjuma Ada, is asking Nigerians to brace up for the further impact of the COVID-19 lockdown, which he says has led to delayed diagnosis on the health of residents, especially on carriers of hepatitis. According to him, as Nigeria continues to flatten the COVID-19 curve, some of the machines used for testing of COVID-19 can also be converted to test for other ailments, he says, like hepatitis, HIV and AIDS, among others. He says instead of making them redundant. He also adds that due to the inability of residents accessing hospitals and the initial disruption in supply chain as a result of the pandemic, ignorant hepatitis carriers should avail themselves for testing and treatment to avoid liver complications.
Delays in diagnosing people with hepatitis would have led to so many people developing liver complications unknown to them. Because of the lockdowns, people could not access hospitals. People could not access the free community testings we do. So that really compounded a lot of problems, and even disruption in supply chains. People that's supposed to be on medication could not access drugs because supply chains were broken. They couldn't travel to hospitals. So we are yet to see the impact of the delayed diagnosis during lockdowns on the health of the communities. But with hepatitis, it will certainly come up. Because any delay, like I said earlier, the liver is getting destroyed. Delay of 1 month, delay of 2 months, delay of 6 months could be very, very catastrophic to the health, could be very, very harmful to the liver. So it's really going to show, obviously, in the shortest possible time. We will see that, but it's because that's the reality. Now, the other positive side of it is that the diagnostic platforms that investments in COVID-19 brought up could be utilized for hepatitis diagnosis.
Well, let's go over to Adamawa State, where the medical director, the specialist hospital Yola, Dr. Dauda Waringa, has described the establishment of an ultra-modern laboratory complex in Adamawa State by the Adamawa State government as timely and a step in the right direction towards improving healthcare delivery. The medical director made the comment while speaking to Channels Television in the state capital soon after the flag-off and foundation laying of the laboratory complex. According to him, the facility will help in conducting extensive research into infectious diseases such as COVID-19 and others. He says it will be a source of medical tourism from other states and countries as well, he says, like Chad and the Cameroon republics.
This laboratory is going to be located in this facility, and as you know, this facility is a 500-bed capacity. Its strategic location in the northeast actually serves the entire northeast plus 2 neighboring countries like Cameroon and Chad. Because of the insecurity in Borno State, most of the patients from southern Borno come to Yola for treatment. You should also know that Specialist Hospital is the only referral center for only primary health care owned by state in Adamawa State. And so the decision to build this multi-purpose, multi-complex laboratory, a public health laboratory in this hospital, is a welcome idea. And this laboratory is going to serve not just people of Adamawa State, but, like I said, neighboring countries.
Well, the Adamawa State Governor, Umar Fintiri, says the establishment of the laboratory became necessary following the challenges posed to healthcare at the height of the COVID-19 pandemic in the state.
Public health laboratory is no doubt an essential component of improving health response, more especially in this age of growing epidemics and rising complex ailments hitherto not commonly known to us. It is on record that Adamawa State, like most states in Nigeria, has witnessed viral disease outbreaks, which include Lassa fever, cholera, yellow fever, and COVID-19, among others. In these instances, samples from suspected cases has to be collected and shipped for hundreds of kilometers to assess laboratories that could confirm the diagnosis. In this long turnaround time for results to get back to our health experts for optimal management, lives often get lost and hopes often get dashed.
The World Health Organization, WHO, is calling on countries around the world to expand their vaccination coverage to protect people's lives and contain the spread of the deadly virus amid a sharp increase in relevant deaths across around the world recently. Now, Dr. Maria Van Kerkhove, COVID-19 Technical Lead of Health Emergencies Program of the WHO, provided a video update on the COVID-19 dire situation globally, including the severity of the Omicron variant infections worldwide. Currently, WHO is working with thousands of scientists to study Omicron and its sublineages.
The global situation with COVID is very dynamic. We are seeing a record number of cases being reported to WHO each week. Every day, between 3 and 4 million cases are being reported to us, and we know that this is an underestimate of the true number of cases. What is extremely concerning is that we are seeing increases in deaths. And in the last 4 weeks alone, we've seen a sharp increase in deaths around the world. Omicron, the latest variant of concern, has quickly replaced Delta, the last variant of concern that was circulating globally. And this has happened very quickly. We've seen a very sharp peak in cases around the world, but not all countries have peaked in terms of their cases. And as I said, the deaths are also increasing as well. People who are infected with Omicron can have anything from asymptomatic infection, meaning no symptoms, all the way through severe disease and death. While there is a lower risk of needing hospitalization if you're infected with Omicron, there are still a large number of people who are requiring hospitalization. So some people are still getting severe disease, and there are people who are dying from Omicron. It's really important that people get vaccinated when it's their turn. But not only that, it's also important that we reduce the spread. The virus is spreading around the world at an incredibly intense level, and we need to reduce the opportunity for people getting infected. First, because people who are infected are at risk for developing severe disease. We also know that people who are infected with COVID-19, infected with the SARS-CoV-2 virus, can also develop long COVID, something we don't have a complete understanding of, and we want to reduce that risk.
Well, when we return, we have more on long COVID, as a new survey in the United Kingdom shows that a quarter of British employers are citing that as a main cause of long-term sickness absences. Do join us again. Welcome back to the program, and we have joining us right now Dr. Adeyeye Arigbabuwo. I hope I got that right, Doctor. Thank you for joining us on the program. All right, Doctor. Good evening. Yes, audio now. We can hear you. Doctor, I'd like to get your thoughts on our vaccination drive. The National Primary Healthcare Development Agency says there is, they hope, or according to them, the target is the 31st of March 2022, and this is to vaccinate 50% of Nigeria's eligible population. Where we are, over 15 million right now, do you think that we can get there by March ending?
Yes, thank you. Nigerians were a very fantastic set of people. And I can tell you, even the milestone we think we are now, we can double that milestone in a couple of weeks. If the will is there, I know Nigerians are ready once to make resources available. The head-seeking habit of vaccine hesitancy and all of that may not be counting much, especially now that people have come to realize of 19 vaccination. Advocacy, education. People are getting to know that prevention is better than cure. And people ordinarily in this country, when you make things seamless, when you make the operational aspects seamless, and they don't have to queue for long, they don't have to struggle to get it, or they don't have to go through middlemen or agencies, that will be very boring. I can assure you, the milestone we are seeing now, that we feel that we are doing very well, we can do much better within a couple of weeks' time to come. If you make it available to them, that's accessibility. It could be easily accessible. Once it's available, adaptability will come in, and people will drop this vaccine hesitancy empirical thing that we are seeing. So I believe we can double this population in a couple of months' time. So the target we are setting, we can go far above it, depending on how we make it seamless for the populace.
But it's also interesting that, on the other hand, you have the WHO also trying to encourage countries to vaccinate as fast as possible, saying that there seems to be a sharp increase in deaths, and a lot of countries are now registering severity on Omicron variant infections worldwide. In terms of booster vaccines, even in Nigeria, we still have people who are hesitant to it, and maybe perhaps a handful who would say, okay, maybe there is a vaccine mandate, so I have to take the first dose, but surely would tell you that for the second and the booster, they're not interested.
Yes, there is no doubt that vaccine hesitancy is a global thing. It's not limited to Nigeria. Neither is it even limited to Africa as a continent. Because of the novel nature of the virus and the way the vaccine comes in with multiple jabs that we are advocating, yes, we see that happening. But with continuous and continual reassurance and people seeing that their neighbors are having it, or they are taking the jabs and they're having little or no complaints, or those who have complained, the complaints are limited, and the death rates are not as alarming, or the death number not as alarming as were earlier postulated. People are beginning to build trust in the vaccine. And so if we look at the death rate, would you be comparing that with what maybe other diseases like cholera, maternal and child death matter, even Lassa fever and other things are doing recently? There are other more, let me say, deadlier issues on ground. So people are beginning to see the fact that there could be some elements of politicking when you are over-exaggerating or you are overplaying the disadvantage of that vaccine over the advantage. That is not to say that there are no side effects or people don't have areas where individual differences will make them to preach hesitancy to others. This is something we've been seeing it, and we cannot stop it ordinarily. Outside the fact that we need to encourage the people and take a feedback from them. If people are genuinely having complaint, they are genuinely having, sequelae that they can say these are complications they are beginning to see. We genuinely welcome them. We don't dismiss them. And once that channel is open, and we'll continue to encourage them as feedback. I mean, you can be rest assured that people will say, okay, look, instead of me, taking this line that looks odd, let me also try and, take my jab and see what it is. After all, the mortality rate as we see it in Nigeria isn't as terribly bad as in probably some other parts of the world, especially outside Africa. So I believe that with what is on ground now, if we all come together, put our resources together, put our minds together, go on advocacy, and we don't condemn people, criticize. We'll only have to reassure them that we can do better. We need to reassure them that can be harmless. We need to reassure them that can be very safe and it can actually prevent. Well, if we say it's going to prevent, we also let them know it's not preventing 100%. It doesn't mean you will not have it, but the chances of mortality.
Essentially building trust. Thank you, Doctor. We appreciate your time on the program. Dr. Adeyeye Aribabuwo is the President, Healthcare Providers Association of Nigeria. Thank you for joining us today.
Thank you.
In the United Kingdom, a survey by a professional body found a quarter of British employers citing long COVID as a main cause of long-term sickness absences, adding that it raised questions over how workers with the condition were being supported in their jobs. British Prime Minister Boris Johnson is leading a strategy for the country to live with COVID, lifting restrictions as booster shots and the lower severity of the Omicron variant weakens. While Britain is still averaging around 80,000 cases each day, mild cases of COVID-19 can still lead to debilitating long COVID and associated symptoms of fatigue, memory issues, and brain fog. Well, the Chartered Institute of Personnel and Development found that 26% of employers now include long COVID as a main cause of long-term sickness absence in a survey of 804 organizations that represent more than 4.3 million employees. Well, joining us now, Dr. Deji Olaleye, a specialist registrar in intensive care medicine, who joins me from the United Kingdom. Thank you for joining us.
Thank you. Hi, Millicent. How are you today?
Hi, very well, thank you. So England is living with COVID, having removed social distancing measures, mask wearing, opening its doors. What are the case numbers saying in real time? And what's the general feeling?
I think general feeling in general is one of optimism. I think life is finally beginning to return to pre-pandemic style. In terms of case numbers, the majority of ICUs in particular, and even the hospitals in extension, are definitely experiencing significantly lower case numbers than seen at the peak of this wave of the pandemic in January, and particularly even lower than it was before, which is why the government is confident to relax all the measures that they instituted previously.
Talk to us about the NHS. I mean, there was talk about the UK putting a pause on the vaccine mandates for them. Have any final decisions been made yet?
The government is looking at the other options, but basically, I think the most important thing is that because of the severity of disease seen with the Omicron variant, which is seen to be much less than the previous waves of the pandemic, it's clear that making the vaccine mandatory may be counterintuitive, especially as the NHS is really struggling in terms of people to fill the vacant posts that will be left once these people leave. So I think it was a sensible thing to do. And I think going forward, the government will come up with a plan, even though workers are encouraged to see that vaccination is a personal responsibility. But I think the government will definitely come up with a plan. But at the moment, employers are no longer mandated to disengage workers who have not been vaccinated.
All right, perhaps a final question to you, and this is, the impact of COVID on the vulnerable in the UK.
Well, I think that that threat still remains, because when we talk about the fact that a good number of population is reasonably protected with vaccination, we still have a small cohort of people who, due to the fact that they're either immunosuppressed, whether from conditions or because they take medication for some other conditions, unfortunately, these people will remain vulnerable. And what the plan will be for those people going forward is not really clear. However, even though those mask-wearing mandates, those social distancing mandates have been relaxed, I would think that the natural thing for those who are at risk, and even for a lot of other people to do, is continue to wear masks in public spaces as much as they can. I for one, continue to do that. I think people still have to take some sort of responsibility in protecting themselves from we don't know whether another pandemic will come up in the future. So I think it's still reasonable, it's logical, it's sensible to only continue to try to protect yourself.
Fingers crossed that won't come to pass. But thank you, Dr. Devt, a specialist registrar in intensive care medicine, joining us from Cambridge. Thank you.
Bye.
And Canada's Prime Minister Justin Trudeau says the protest by truckers has paralyzed the capital, Ottawa, has to stop. He said Canadians were shocked, frankly disgusted by some protesters' behavior, while the lorry drivers have been rallying against Canada's COVID vaccine rules. Here's more on the global update.
The Spanish government has announced that Spain will lift the requirement for people to wear masks outdoors from Thursday. Mask wearing outdoors was reinstated in late December to curb the spread of the emergent Omicron variant of the coronavirus. Over the past 2 weeks, the COVID-19 contagion rate in Spain has steadily fallen, reaching 1,997 cases per 100,000 people on Monday, down from almost 3,400 in early January. Germany's health ministry says the coronavirus situation is still not under control and an Omicron infection wave is still expected to peak around mid-February. The health minister says easing measures anytime soon would significantly extend the wave. Over the past 24 hours, Germany reported 169,571 new daily cases, and the 7-day infection incidence rose to a record of 1,441 cases per 100,000. Italy has started rolling out Pfizer's COVID-19 pill to vulnerable people for who the vaccine can be less effective. Paxlovid, a combination of Pfizer's pill with an older antiviral ritonavir, is the second antiviral being rolled out in Italy after molnupiravir. The country has registered 149,097 deaths linked to COVID-19 since its outbreak emerged in February 2020. Away from Europe, Hong Kong has announced stringent new coronavirus restrictions and a record number of new infections. It comes as a shortage of vegetables is adding to the misery, with truck drivers testing positive for COVID-19, unable to bring them from mainland China. The Asian financial hub reported a record 625 coronavirus cases over the past 24 hours, with Austricities saying cases are likely to continue rising rapidly. There were
ChannelsTV.com, our website, has more information and updates, plus other stories at your fingertips. Well, that's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.